Welcome to our journey through one of the world's greatest challenges, cancer. Cancer has a large impact affecting the lives of people, families, and healthcare systems globally. This presentation highlights three countries, the United States, Norway, and Thailand. Oftentimes, when people think of the main cause of death in the world, they think of car crashes, heart disease, or even COVID, but cancer is actually the second leading cause of death worldwide. This is because there's no cure for it. Only treatment and prevention can help it with a huge risk that it won't even work. Let's take a look at the global picture of cancer. Cancer rates are on the rise globally, showing the urgent need for action. Healthcare systems face many pressures to deliver timely and effective care to those in need. From diagnosis to treatment and beyond, the demand for comprehensive cancer services continue to surge. Prevention lies at the forefront of our efforts to combat cancer. By promoting healthy lifestyles, advocating for vaccination programs, and addressing environmental risk factors, we can reduce the incidence of cancer and save countless lives before the disease ever takes hold. Our journey takes us through three distinct countries, the United States, Norway, and Thailand. They each have unique healthcare infrastructure, policies, and cultural contexts. Despite differences, these countries face common challenges in tackling cancer, like access to healthcare and funding constraints. Despite these differences, Norway, the United States, and Thailand share a common goal to alleviate the burden of cancer and to improve the lives of those affected by the disease. By embracing their unique strengths and initiatives, these countries amplify the power of global collaboration in the fight against cancer. In the United States, Norway, and Thailand, diverse approaches to cancer care shine. U.S. research institutions lead in genetics, immunotherapy, and treatments. Norway prioritizes accessibility with mobile screenings and telemedicine. Thailand combines modern and traditional medicine for holistic care. Norway faces regional access disparities. The US grapples with socioeconomic barriers, and Thailand confronts cultural and geographical obstacles. Despite these, all three nations are tackling the issue through targeted intervention and policy reforms to ensure equitable access to quality care for everyone. When we think of who is affected most by cancer, we never really think about who is more susceptible because oftentimes it seems random or people do unhealthy things that cause cancer. But it has been found that African Americans have had a higher overall death rate caused by cancer than any other racial and ethnic group in the United States. As I mentioned before, in the United States, African Americans are most affected by cancer. But when we look at the countries Norway and Thailand, it's a little bit different. In Norway, cancer is higher in immigrants from low income areas, affecting more men than women. In Thailand, rural areas have limited access to specialized cancer care facilities, leading to disparities in healthcare outcomes. In the healthcare system of the United States, Norway and Thailand, they both have similarities and differences. The US mainly relies on private healthcare, while Norway and Thailand have universal healthcare systems funded through taxation, ensuring coverage for all residents. Norway and Thailand prioritize equity and accessibility, whereas the US faces challenges with affordability and access. Every healthcare system has its strengths. In the United States, it's all about high-tech treatments. Norway nails it with universal healthcare for everyone. Thailand, they've got a good mix of modern and traditional care. It's awesome how they all keep people healthy in their own unique styles. On the contrary, every system has its quirks. In the United States, affordability and access can be tricky. Not everyone can get the care that they need when they need it. Norway's universal system is good, but wait times can sometimes be long. And in Thailand, while their holistic approach is great, there can be disparities in care between urban and rural areas. So yeah, each place has its challenges, but they are working on making things better. While governments are different worldwide, they all play a crucial role in addressing the challenges of cancer treatment. They try their hardest to find a cure to this awful disease by funding research, setting up public health campaigns, investing in healthcare infrastructure, and implementing policies and legislations to promote healthy lifestyles. Countries handle cancer differently. In Norway, early detection and treatments are key, with a focus on healthy living and screenings. In the United States, healthcare varies, affecting access to screenings and treatment. Thailand is working on healthcare access and deals with varied cancer rates due to lifestyle and economic factors, promoting awareness through public health campaigns. I talked a lot about lifestyle factors that can lead to cancer and how providing information about them can hopefully lessen the rates of it. Some of these factors include tobacco use, unhealthy diet, lack of physical activity, excess alcohol consumption. Even though I only listed a few, there are still many ways that can contribute to the increased cancer risk. Healthcare systems globally have not found a cure for cancer yet, but they try their hardest to do so. Researchers all around the world study risk factors, collaborate with each other by sharing data and finding it to accelerate discoveries, and they investigate disparities in cancer access to identify and address barriers to equitable care. So what's next? So what's next in the fight against cancer? Collaboration, innovation, and investment aren't just buzzwords. They form the basis of our united effort to beat cancer. By following these suggestions and joining forces with determination and empathy, we can change the course of cancer and build a healthier, brighter future for all. What did I learn? The way Norway and the United States and Thailand tackle cancer varies due to healthcare systems, culture, and government involvement. Norway emphasizes preventive care with positive outcomes. The United States has healthcare access issues but leads in medical innovation. Thailand faces healthcare access challenges and varying cancer rates. Norway values health awareness. The United States navigates diverse attitudes, and Thailand blends traditional with advocacy. Governments in each country invest in healthcare and research to address cancer. Thank you for listening to this Ignite presentation about the healthcare problem, cancer. I hope you all enjoyed hearing about how cancer differs and is similar in different countries and how government and healthcare providers strive to find a cure to this horrible disease. I hope you all have a great day.